Welcome to Indispensable, Connection Ministries' video training series for churches and volunteers who are building Christian community with adults with intellectual disabilities. This episode is titled Descriptions of Disabilities and is the second episode on companion training.
My name is Jackie Schaefer, and welcome to Indispensable, a video training series for friendship groups with adults with intellectual disabilities. The episodes included in the companion training topic cover subjects such as the role of a companion, the spirituality of those with disabilities, volunteer roles in a friendship group, spiritual gifts, ways to communicate, and how to extend your relationships beyond the weekly friendship group. In this episode, we will look at a description of different types of intellectual disabilities. The weekly friendship group is a community where our friends with intellectual disabilities, families, direct support staff, and church members can grow in Christ and minister together. It is important to communicate to both the families and direct support staff that they are welcome and even encouraged to be part of the friendship group. Don Bowden will now talk about the different types of developmental and intellectual disabilities and their characteristics.
Let's start by defining the terms developmental and intellectual disability. While a developmental disability includes intellectual disabilities, it also refers to other disabilities which occur during the developmental years of someone's life that has affected their ability to learn. This usually occurs before the age of 18. Mental illness is not a developmental disability. However, a person with a developmental disability may have a dual diagnosis that includes mental illness. Developmental disabilities are a chronic disability that can be cognitive or physical or both. Some developmental disabilities are largely physical issues such as cerebral palsy or epilepsy. Some individuals may have a condition that includes both physical and intellectual disabilities, such as Down syndrome. An intellectual disability is characterized by a significant limitation in both intellectual functioning, which includes reasoning, learning, problem solving, and adaptive behavior, which covers many everyday social and practical skills. According to data published by the ARC, between 1% and 3% of our population is born with an intellectual disability. Intellectual disability is one of several developmental disabilities where there is evidence of the disability during this developmental period. One way to measure intellectual functioning is with a nonverbal intelligent quotient, or IQ test. Generally, an IQ test score below 70 or even 75 indicates a limitation in intellectual functioning. Conceptual, social, and practical skills will also be more limited. Disabilities that may or may not accompany an intellectual disability include autism and autism spectrum disorder, known as ASD, Down syndrome, and cerebral palsy, or CP. An intellectual disability could be caused by genetic conditions such as Down syndrome. The disability could also be the result of pregnancy issues, malnutrition, environmental toxins, or infections in the mother. Issues during birth, such as premature birth, low birth weight, oxygen deprivation, or other injuries or problems after birth, like childhood diseases, head injuries, or near drowning, can all result in an intellectual disability. Poverty and cultural factors could be a cause as well. Children who live in poverty have a much higher risk of experiencing malnutrition or exposure to environmental toxins and diseases. Connection Ministries focuses on ministering with adults diagnosed with intellectual disabilities. However, as intellectual and developmental disabilities often co-occur, many times we minister with people who have both types of disability. Now let's talk about the other types of intellectual and developmental disabilities and common characteristics. There's autism, or the autism spectrum disorder, referred to as ASD. These are a group of complex disorders of brain development. These disorders are not intellectual disabilities, although a 2008 study by CDC shows that 38% of people with ASD also have an intellectual disability. ASD is characterized in varying degrees by difficulties with social interaction, verbal and nonverbal communication, and repetitive behaviors. Along with intellectual disabilities, individuals diagnosed with ASD can also have difficulties with motor coordination, attention focusing, and having physical health issues. Some persons with ASD may excel in visual skills, music, math, and art. According to the CDC, 1 in 59 births in the U.S. result in ASD. The actual cause of autism is undetermined, although ongoing research continues. Characteristics of Down syndrome include difficulty with speech as a result from a thick tongue. Other characteristics include a varied degree of intellectual disability, being short in stature, decreased muscle tone, tendencies towards obesity, flattened facial profile and nose, and short, broad hands. When interacting with people with Down syndrome, remember to be patient. If you have a hard time verbally understanding a person with Down syndrome, don't hesitate to ask them to repeat themselves or find assistance with a family member or caregiver. Above all, interact normally, as they understand more than you think. Lastly, we'll talk about cerebral palsy, or CP. CP is the result of brain damage caused by injury or abnormal development of the brain before, during, or immediately after birth, or during the developmental years. It affects body movement, muscle control, muscle coordination, posture, and balance. Those with CP may also have vision, hearing, and speech difficulties. CP may or may not impact intelligence. According to the CDC, about 40% of children with CP will also have an intellectual disability. When interacting with people with cerebral palsy, don't hesitate to ask them to repeat themselves or find assistance with a family member or caregiver. If you have a hard time understanding a person diagnosed with CP, be sure to interact normally, as they understand more than you can think, and ask if there is any way you can help before helping. Thank you for watching this episode about companion training. Next to this video on our website, you will find a link for a note page that you can download and print. Be sure to visit our website to view another topic in the Indispensable series. Join us for the next companion training episode, as we will cover the spirituality of people with intellectual disabilities. If you have any questions or need information, you can email us at connection-ministries.org or call our office 317-646-5067. Your prayers and financial gifts help Connection Ministries provide valuable resources for churches and families ministering with adults with intellectual disabilities. You can give online at www.connection-ministries.org.